this actually, COVID might be helping this one because many of you have had a hard time getting to your doctors, and so maybe you haven't been able to refill some of your prescriptions. And so in that regard, this might actually be in your bone's favor, because if you look at here, medications that can actually contribute to bone loss, there's a long list of medicines that we know can contribute to bone loss. Statins, we know that statins can contribute to bone loss. Actually, statins are known to lower vitamin D, and of course, you need vitamin D. Vitamin D is as a nutrient. What it does is it tells your small intestine, tells the cells of your small intestine to absorb calcium. So statins, because they can contribute to vitamin D deficiency, can contribute to bone loss. The statins also lower CoQ10. We talked a little bit about this a couple of weeks ago, CoQ10 as being very important for your cell's ability to generate energy, and this includes your bone cells. And then blood pressure medications. Blood pressure medications deplete minerals. Many of them are the diuretics specifically. So if you're on like a thiazide diuretic, hydrochlorothiazide, or if you're on a potassium-sparing diuretic, these things can cause calcium and magnesium deficiencies. And then we've got steroids. Steroids also can contribute to calcium, magnesium, and vitamin D deficiencies. But steroids, also long-term steroids, drive up blood sugar. And, again, when you increase blood sugar, that increased acidity can actually put pressure or demineralize or lead to demineralization of your bone. So long-term steroid use. So those of you maybe that are on asthmatic inhalers, maybe those of you who are taking, oral steroids for chronic things like chronic fatigue syndrome or things like fibromyalgia. A lot of times I'll see doctors who prescribe a lot of hormones, like a lot of your hormone centers. They give a lot of estrogen, progesterone, and they'll give corticosteroids at very low doses. But the problem is the longer you're on it, again, these things start to happen. So I see a lot of doctors prescribing these in low doses, not the high dose steroid packs that you get off of after 10 days, but the long-term use can lead to these types of problems. And then those of you with diabetes on diabetic medications, particularly metformin, for example, which is one of the more common ones, can lead to vitamin B12 deficiency, can lead to folate deficiency. You need both these B vitamins, very critical for bone building, for bone growth, and then also CoQ10 deficiency. So, again, the medications, the general mechanism here of action is that medications that cause bone loss predominantly do so by affecting nutrients. So it's very important. And the takeaway message, and I've talked about this a number of times over the last few weeks, the takeaway message here on this one should be for you, if you're being prescribed a medicine to treat a particular disease or symptom or syndrome, the conversation you should have with your doctor is, Doc, you're putting me on this medication. Talk to me about the vitamins, the minerals, the nutrients that might be interfered with or depleted as a result of being on this medication long term. Usually medications aren't a problem if we're talking about a couple of days. So like somebody maybe has a surgery and then they're using some Tylenol for a week after the surgery. That's not what we're talking about here. We're talking about the chronic use of medications over time. Again, most of these diseases listed here, most of these medicines are for chronic issues. So again, statins for hypercholesterol, right? Blood pressure, chronic. Steroids for chronic pain, diabetes, chronic disease. Blood thinners. If any of you have had a heart attack or stroke, a lot of times doctors keep you on blood thinner. I had somebody actually come in last week. They've been on blood thinners now for 2 years, and their doctor had no plan, no intention. Nobody even measured whether or not their blood was thick. They just had them on blood thinners. And, again, blood thinners in a woman who's over the age of 65 and gone through menopause, and just by the nature of being a woman and just by the nature of having malnutrition, now adding blood thinners, it's just one more element, right? It's one more issue, one more thing that can contribute to bone degradation. And the main one here, so again, if you're looking, the predominant blood thinner is heparin. So if your doctor's prescribed you heparin, talk to your doctor. If you are osteoporotic or if you've been diagnosed with bone loss, you might want to have that information. Anti-seizure medication. So if you've been diagnosed with epilepsy, Seizure medications cause B12 deficiency, they cause B1 deficiency, they cause CoQ10 deficiency. And so again, can affect long-term the health of your bone. But actually, a number of studies have actually shown, even beyond these nutritional deficiencies, that this class of medication can actually increase the risk of fractures. And so that's where we're really concerned. And then ladies, if you've ever been on progestin, especially so like Depo-Provera, which is the kind of medication that generally is injected, but it's a form of chemical progesterone, but it's progestin. And so this medication, this birth control, and sometimes I've seen women take it as a result of trying to like avoid having a child, but I've seen some women take it for years, and that's the problem during their formative bone years. Remember, your formative bone years, ladies, you're going to hit your peak bone density somewhere around the age of 35, and so if you're on birth control from the age, let's just say, of 16. Up to the time where you're getting ready to maybe get married and think about having or starting a family. In some cases, I've seen women on this for multiple years, right? 10 plus years. And so that's where you really run that risk. And that's during formative bone density years. You don't want to necessarily do that to your bone. There are other options for birth control. And then this is another really common one. And so this one doesn't have anything to do with nutritional deficiencies. But thyroid medication, if your dose is too high, you can actually contribute to bone loss. And I get this a lot. It's one of the reasons why I wanted to list it here, because many of you, as a matter of fact, how many of you watching the show tonight are taking thyroid medication? And so if you are, pay really close attention, because if you're taking thyroid medication, here's the thing. If your doctor is saying, hey, we're just going to monitor this every once in a while, that might not be a great idea. My advice is, if you're on a thyroid medication and you're trying to figure out, and your doctor's working with you, try to figure out what that dose is, oftentimes your TSH will come back under less than 0.5. And so I've seen this be the case. So 0.5 is considered too strong of a medication. So again, if you're taking a medication, the lower your TSH, below 0.5, that means your medication might be too strong. And so if you're waiting a year or 2 years in between getting it checked, getting this TSH checked, because most doctors, they won't check your T3 or T4. They predominantly will, if you're not working with somebody in functional medicine, they'll predominantly only measure your TSH. And so if you're going big gaps of time and you don't even know it, and let's say your TSH is under that 0.5, I see cases where sometimes it's like 0.01 ... which is much, much lower. Like these are problems because, again, too much thyroid medication that dose being too high is going to definitely contribute to bone loss, aside from other problems. Like too much thyroid medication can also contribute to heart disease, heart problems, can put too much pressure on your heart. It can disrupt sleep, and it can cause hyperanxiety. I see a lot of women too, after going on these medications, developing anxiety because their doctor wasn't monitoring their TSH aggressively enough. And so in the first year of being on any kind of thyroid medication, you really want to, my advice to you would be to ask your doctor to check this, 3 to 4 times during that first year, so that you get a good idea. Is that too low? Is it too high? Where's it at? So that you're not contributing potentially to too strong a medication causing bone loss for you. So these major medications, all known to contribute to a deterioration of bone, either through direct increased risk for fractures, or through nutritional deficiencies, or through the direct mechanism of action of the drug itself. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.